Welcome to the American Shoulder and Elbow Surgeons podcast. I'm your co-host, Brian Waterman, sports and shoulder elbow surgeon at Wake Forest, and I'm fortunate to have Peter Chalmers, a shoulder and elbow surgeon at the University of Utah in Salt Lake City, as my co-host. Before we get started, I should mention that the views expressed in this podcast do not necessarily reflect the views of the ASES, University of Utah, Wake Forest University, or any of the institutions of any of our guests. Additionally, by way of transparency, I'm currently a consultant with Arthrex, and we do receive fellowship support as well. Well, along with Peter, we've been really launching into this special series on the podcast that focuses on our industry colleagues and innovators in the field. Today, it gives us a special pleasure to step out of the box again and welcome a giant in the field, not just the sports medicine and shoulder surgery, but the entire field of orthopedics, minimally invasive surgery, and the practice of medicine in general. Reinhold Schmieding is the president and founder of Arthrex. Reinhold, welcome to the podcast today.
Good morning, Dr. Waterman. It's good to be with you.
It's our honor to have you. Let's launch in. For those that are unaware of our guests, your company has been a long-standing leader in the field. You have over 10,000 employees, you have 25,000 product innovations, and truly a worldwide presence. Arthrex stands out in this regard. Can you share with us how this all got started?
Well, my parents were physicians. They immigrated from Germany in 1954. I was born in Michigan in 1955. So I'm made in Germany, born in the USA. So it gave me some special traits in order to pursue. My dream was to go to medical school. I went to Michigan State University on a pre-med program. I majored in physiology. And then instead of going to medical school, I was recruited to go in the orthopedic industry in 1977 after graduating, and went to Germany to pursue a career in medical device. I worked in Germany for 3 years, literally every day scrubbing in with German surgeons. Was a great training opportunity for me to learn everything about orthopedic surgery. And then 1981, I was in surgery watching diagnostic arthroscopy, and surgeons in Munich were asking me if they could treat the meniscus arthroscopically, and they needed some help. And I decided to quit my job and start a company in a foreign country by myself, without financing, in a market that didn't exist, to help these surgeons perform arthroscopic surgery of the knee. That was the beginning of Arthrex in 1981.
And it's a fascinating and really bold step of faith. So you were working as a industry representative?
I was a European manager for one of the American companies living in the Black Forest region in Tulligan. So I was fortunate to get to know some of the manufacturers of all the surgical instruments. So when I was challenged by surgeons to help design instruments, I was able to source them and certain manufacturers in the Black Forest. Of course, one of the advantages being in Germany, there were no regulatory bodies at the time that determined the quality of the products. The surgeons can make the decisions, so that was a wonderful opportunity to bring instruments in, and surgeons would decide if they were adequate to use in surgery. So that helped rapidly develop new products in the early 80s.
And as you mentioned, so much of that early focus was on knee arthroscopy. Do you remember your first foray into arthroscopic shoulder surgery?
I do. I developed one of the early arthroscopic bankard repair techniques. And with Peter Habermeyer, we did the first cases in 1983. It was a cannulated grasper where you could come in anteriorly, grab the labrum and position it on the glenoid. And then there was an outrigger that would go over the shoulder and indicated a spot in the back of the shoulder. And you would drill a beath pin through the grasper, through the labrum, through the glenoid, and come out the back in a safe area. And we would do 2 pins, and then we would pass PDS sutures at the time, tie mulberry knots in the back, bring them inside the soft tissue down to bone. And then we had to push a knot anteriorly, and we had developed the first 2-hole knot pusher at the time. And we pushed knots anteriorly, and that was the first arthroscopic bankard procedures in Europe in the early 80s. So we were proud of making advancements to help surgeons do labor repairs arthroscopically, literally 40 years ago.
Yeah, it's amazing to think about the history of that. Fast forward now with knotless technology and more minimally invasive technique, how far we've come.
Yes, definitely. We've had technology advancements really every year since those early 80s, and today it's obviously much more reproducible. And need to do transosseous drilling. We can do things with suture anchors in a less invasive manner.
And you've highlighted this, right? In order to persevere and foster that innovation that you've been so good at achieving, you've surrounded yourself with excellence at every step of the way. How did you go about creating this culture?
Well, I was very fortunate to have great surgeon mentors advising me for the last 44 years. Some of the pioneers of arthroscopy, like Laney Johnson, Bob Jackson, Steve Schneider, John Fagan, John and Bill Garrett, Peter Habemeyer, Neil Alatrash, Jim Taboni, Jim Bradley, and many others in the United States and Europe were my friends and mentors for the last 40 years and provided me great guidance, and were great sounding boards in terms of what problems we needed to solve and what were the potential solutions together, and if we're always doing the right thing for surgeons and their patients. So those are been my mentors and friends for many years and still are today.
One of the other things that I've loved about Arthrex is you certainly have instilled a culture of mutual accountability. Is that a spinoff of your leadership style, or how is that something you instill that within the body of the company?
We're very fortunate. Arthrex still today, after 44 years, is still a private company without outside investors. And really, that gives us the freedom to be dedicated to scientific principles, to pursuing medicine without compromise to help surgeons treat their patients better. And that mission is very motivating to our employees, because we're doing the right things to help surgeons, and we don't have to compromise for economic gain. Our mission's very pure. It's simply to help surgeons treat their patients better. And that makes Arthrex really unique, and also makes us more trustworthy because we're always doing things for the right reasons to help surgeons and their patients and aren't influenced by investors that have other interests.
Yeah, it's evident that the mission statement continues to motivate you to this day, and there's this culture of constant change and iteration and adaptive thinking. So it's evident that is still very top of mind for you, even in this stage in the game.
Yeah, really, some of the key pillars is obviously product and technique innovation, medical education, the quality of what we do, and also the quality of our representation out in the field. We have over 5,000 representatives and technology consultants in the United States alone that help surgeons on a daily basis and have the clinical training to really provide real value in the operating room.
And so you have, correct me if I'm wrong, you have over 1,500 patents at this point?
So we're approaching 3,000 at this point after the last 44 years. We grow with hundreds of patents every year.
I can't even keep up. The pace of development is staggering, and it's been amazing to watch the evolution from orthobiologics and shoulder reconstruction now to spine and thoracic surgery. Arthrex as a company is diversifying considerably. What technology are you most excited about today?
Of course, we've been pioneering arthroscopy now for the last 44 years. I was able to be part of the transition from open surgery to arthroscopic surgery. And I'm really excited with new technology, which we call nanotechnology. It's essentially chip on a wire. It's a 1.9 millimeter diameter flexible arthroscope that's going to replace the rod lens arthroscope as we know it today in the next coming years. Right now, we're introducing a new generation called the Nano Needle 2.0, which really has the same resolution as our 4K camera, but it's only 1.9 millimeter diameter. So we're going to minimize the diameter of the instruments. We're going to maximize the visibility within the joint, and chip and a stick technology is going to be the future. And that'll be the next generation of arthroscopy as we know it today. So I'm super excited about that. And that's going to have a major impact on upper extremity procedures in the shoulder, in the elbow, and the wrist.
That's amazing. Is that something you envision ultimately being utilized in the office or still in more of a traditional OR context?
Well, both, of course. Most surgeons will start in the operating room as an alternative to a 4 millimeter arthroscope. And as they get comfortable, they'll seek more indications in the treatment room where you can treat patients under local anesthesia or potentially as a diagnostic procedure in the office.
One of the other things you highlighted among your pillars is your passion for education. I know that that's been one of your highest aims. It's to create a fully immersive experience and a personalized learning environment on your campus in Naples. Studio X is a great example of this. And I'd love for you to just dig in a little bit and tell us a little bit about the setup of Studio X as well as the education environment that you've laid out there and the wide-ranging applications for its use.
Well, Arthrex has been dedicated to surgical skills training for the last 44 years. When you innovate at that pace, you need to create a safe and ethical environment for surgeons to practice those skills without having to experiment on their patients. That's a ethical and a moral responsibility that we carry. We have over 100 surgical skill labs around the world. This year, we anticipate servicing over 100,000 surgeons in our surgical skills labs around the world. So we're really very proud of our contribution to medical education and surgical skills education. Studio X is the highlight of that experience, where we can have live surgical demonstrations or cadaveric demonstrations in a mock OR that really replicates what it's like to be in surgery, and really close the gap between all the innovation that we create every year and educating surgeons around the world, on those new techniques. So Studio X has been a powerful tool, and also creates an environment where surgeons and administrators can come visit, and they can actually see the OR of the future in a real space and actually make design changes essentially real time. So that's also been a great asset for surgeons and administrators that really want to visualize what an OR in the next 3 years looks like.
Yeah, and because you touched on that, what's the future state OR as you've envisioned it? I think you have some really interesting ideas.
There's a lot of exciting technology. Of course, technology changes everything in orthopedics. So to really anticipate what's next, you want to put it in a virtual room so you can actually envision what's coming next. And that's what's really great about Studio X. Obviously, less invasive procedures, obviously orthobiologics, nanoarthroscopy, everything in the future is going to be less invasive, hopefully simpler, safer, and more reproducible to really facilitate outpatient surgery and better patient outcomes and better return to daily living and sports with the least invasive treatments possible. That's really our goal.
Yeah, and it's an amazing facility. It's probably only rivaled by that seen in Hollywood, and the amount of technology and thoughtfulness that's gone into it is quite impressive.
Yes, thank you. It's a major investment, never been done in our industry before, to really visually see the future and be in a space where you can actually see the operating room and make real changes with architects, on the fly, to really have a visual plan for the future of ORs prior to building an ASC or a hospital.
We've seen the evolution of the education front as it relates to surgical skills training. There's an increasing, I think, prevalence of industry-sponsored courses. There's definitely unique environments. There's training modules. And so we're seeing definitely a diversification of who provides that surgical training and how it's accomplished. I'm curious what your vision is for the surgical skills training environment of the future. How do you think we get that done in a surgeon context? And, is there still an over-reliance on cadaveric work? Do you think trainers or virtual modeling is going to be the future? I'm curious your thoughts.
Well, cadaveric training still is the gold standard and will be for quite a while. We're the leaders of developing 3D printed anatomy, so that's going to be an exciting alternative to cadaveric training in the future. We're printing, obviously, pathology that replicates the specific patient's pathology, so that'll give us a unique opportunity to offer training on pathology that is not available in a cadaver, right? So that's really exciting new options with 3D printed anatomy. And 3D printed anatomy really replicates bone density, tissue quality, really much closer than even a cadaveric specimen. Even be able to use special dyes, to be able to show injury to a vessel or even a nerve, which you really can't do in a cadaver, is going to be a really exciting advantage using 3D printed anatomy. So we're already producing 3D printed anatomy in our facility, and we're ramping up as quickly as we can. And eventually, 3D printed anatomy may replace the need for cadaveric specimens in the future. It'll take a few years to build the volume, but right now we have the capabilities to do something very specific off a CT scan and replicate that anatomy exactly so the surgeon can actually do the surgery on a particular patient before they actually do it. That's replicating exactly the patient's pathology. So that's an exciting new option that cadaveric training doesn't offer.
Yeah, that's pretty interesting, really replicating that specific disease state, but then even going a step further and personalizing it to the patient that you can have on your OR table the next week.
That's right.
Yeah, and that seems like the applications would be endless, but the ones that are most accessible in my head is thinking about shoulder instability and bone block options, but then also thinking about bone loss in an arthroplasty setting as well. So really fascinating stuff. I'd commend you on leading on that front.
Thank you.
I've also been amazed at the unprecedented growth of your shoulder arthroplasty portfolio. You've certainly led in the widespread adoption of stemless anatomic shoulder arthroplasty, bridging from Europe to the United States, but then also the whole concept of virtual preoperative planning and really increasing the modularity and design options, particularly for the reverse. You've seen around curves for this. Can you give us a preview of what the next frontiers are for shoulder reconstruction with Arthrex?
Yeah, we had dramatic growth, in shoulder arthroplasty for the last 25 years. Some of the things we're really excited about right now is obviously subscap repair. So the FDA just released our suture patch. Basically, it's a patch made of fiber wire that we can use to augment subscap repair. We can also biologically augment the patch, using the proximal biceps as a graft, putting in a special press and creating an autograft patch from the proximal biceps, adding that to the suture patch. Now we have a new option for subscap augmentation. So that's an exciting advancement that's happening right now. Of course, our VIP preoperative planning, it's been revolutionary to be able to take a preoperative plan, having a reusable, adjustable targeter that doesn't cost really anything, and then having weekly updates, in our software to really advance preoperative planning. So that's been an exciting addition as well for shoulder arthroplasty.
One of the gems that I know you've been proud of and certainly has been a great community for me is the SHARC group, and that's the Shoulder Arthroplasty Research Committee. It's been a foundational part of your innovation process within shoulder arthroplasty, and you've had several surgeon leaders, to name a few, friends and colleagues: Tony Romeo, Peter Habermeyer, Philippe Moroder, Pat Denard, Brian Warner, Justin Griffin, and definitely so many more. These are just individuals that I've worked closely with. They've asked a lot of really great questions over the recent past, and I think this has really helped to steer the practice of shoulder reconstruction. Maybe if I could ask you, just what have been the most impactful findings to emerge from this group over the past several years?
When we started SHARC 10 years ago, it was a huge investment in employees and research costs at 17 enrollment sites. After 4,000 patients enrolled in 85 peer-reviewed publications, we not only feel very good about the implant survivor rates, we've also been able to tease out the results and how to optimize motion while decreasing complications. So we're excited about investing in the future of SHARC, and building that registry to make sure that all our products procedures are proven, safe and reliable.
Yeah, it's incredible. The folks that you have steering at the helm are really doing an excellent job. These are large findings that lead not just for this prosthesis but for the entire field in general. Without question, your list of accomplishments are many, both with and outside of your company. Is there one specific accomplishment within Arthrex that you're most proud of?
Of course, we're proud of a lot of things. 25,000 products over the last 44 years. It's quite an accomplishment to really see the impact on orthopedic surgery as a less invasive procedure, from those early years where everything was done open. And now so many procedures are done arthroscopically with biologic augmentation. We've been honored to be able to contribute to. Of course, if you look at the history of Arthrex, we're a major corporation, close to 20,000 employees around the world, over 2,000 new products a year, over $100 million invested in medical education every year. But it's still a private company without outside investors, dedicated to one thing: helping surgeons treat their patients better. So that's very unique. Obviously, you can imagine how challenging that was in the early years without outside financing. But we've been able to preserve our mission and remain as a private company that's dedicated to people over profits, right? And be able to respond to surgeons and their needs based on scientific principles that we haven't wavered from for the last 44 years. So I think I'm very proud of that. And of course, again, contributing to this year, over 100,000 surgeons around the world will be able to use a surgical skills lab sponsored by Arthrex. So we're of course very proud of our contribution to surgical skills education. Just some of the things that we're very proud and excited about, and then we will continue that dedication to surgeons and their patients, for decades to come.
It's definitely paying it forward to the next generation. I want to offer you the opportunity to have the final words of wisdom to our shoulder and elbow listeners. Anything you'd like to share?
Well, I really appreciate the opportunity to talk with you today. We've been dedicated to product development, medical education, and representation in upper extremity surgery for the last 44 years. And upper extremity products and procedures still represent the majority of all the products Arthrex really produces. We're excited about the present, but also excited about the future, how we can make procedures simpler, safer, more reproducible, and less invasive. And, we'll continue to be dedicated to listening to surgeons, solving problems in the shoulder and elbow. And we will be investing every year in research, innovation, medical education, improving representation to really help surgeons every day to treat their patients better. That's really the mission of Arthrex, and I'm just part of that team. And I will continue to do that for many years. And we really are appreciative of the trust that surgeons have in us and our products. And we're going to work hard every day to earn that trust and be real partners for helping surgeons treat their patients better.
Well, as just one ASES member, I can tell you the synergy that occurs between surgeons and our industry colleagues, especially our leaders, it can't be underscored. It really is a great opportunity, and we're so appreciative of your collaboration and support throughout the years.
Yeah, thank you for the time today, Dr. Waterman. I appreciate talking to your membership.
Well, it's our honor, truly, and we want to thank you again for being our guest today. That's about all the time we have for this episode. We want to thank all our listeners out there. Don't forget to subscribe. And then for Peter Chalmers, I'm Brian Waterman. We'll see you next time. Thank you.